Hello everyone, I'm Anas Al-Ubaidi, and the topic or the session for this lecture or session is core medical terminology and specialty specific phrases within the chapter of review, within the chapter that covers the review of medical terminology and HIPAA certification within the Certified Medical Administrative Assistant course program by ACMSO. Introduction. Medical terminology serves as the universal language of healthcare, allowing professionals to communicate with clarity and precision across disciplines. These terms, rooted in Latin and Greek, provide standardization, reducing the risks for misinterpretation and errors in patient care. Mastery of medical terminology is essential for effective communication among doctors, physicians, or clinicians, nurses, medical scribes, and other healthcare providers. It facilitates seamless documentation, accurate diagnoses, correct treatment planning, and patient education. For medical scribes, understanding and using medical terminology efficiently is particularly crucial. Scribes act as the bridge between what is discussed with the patient and how it is translated into medical charts. Their role ensures that patient records are clear, detailed, and reflect the exact medical scenarios without ambiguity. Familiarity with root words, prefixes, suffixes, and specialty-specific terms allows scribes to expedite their tasks and contributes to better healthcare outcomes. Objectives for this session: understand the basic structure of medical terms and their components. Recognize common prefixes and suffixes crucial for healthcare documentation. Learn specialty-specific phrases and their clinical significance. Acquire techniques for mastering medical terminology efficiently and effectively. Apply medical terms accurately in practical scenarios, avoiding errors. Key points. Basic structure of medical terms. Components. Medical terms are typically constructed using three fundamental components. Root words. The root word forms the base of a term and usually indicates the body part, organ, or system involved. For example, never, an N-E-P-H-R, refers to kidneys. Cardi, C-A-R-D-I, refers to the heart. Prefixes. As prefixes are added at the beginning of terms to modify their meaning, indicating location, number, time, or status. For example, hyper means excessive or high, as in hypertension, high blood pressure. Brady means slow, as in bradycardia, slow heart rate. Suffixes are attached to the end of terms to specify a procedure, condition, disease, or disorder. Example, itis, I-T-I-S, refers to inflammation, as in arthritis, inflammation of the joints. Ectomy, E-C-T-O-M-Y, denotes surgical denotes surgical removal, as in appendectomy, removal of the appendix. Ectomy. Application and practice. Medical scribes often encounter compound terms with multiple components. By breaking terms into root words, prefixes, and suffixes, they can deduce the meaning even when unfamiliar with the full terminology. Common medical prefixes and suffixes. Prefixes, we have brady, meaning slow. Example, bradycardia, slow heart rate. Tachy, meaning fast. Example, tachypnea, rapid breathing. Hypo, meaning below normal. Example, hypoglycemia, low blood sugar. Hyper, meaning above normal. Example, hyperthyroidism, overactive thyroid. And here is a diagram on medical prefixes. Hyper meaning above normal, example hyperthyroidism, overactive thyroid. Suffixes, of course, also is a diagram on medical terminology, prefixes and suffixes. Suffixes: ectomy meaning surgical removal, example appendectomy, surgical removal of the appendix. Scopy, scopy, meaning visual examination, example endoscopy, examination of the interior of a body canal. Algia, algia, meaning pain, example neuralgia, nerve pain. Pathy meaning disease, example neuropathy, nerve disease. Application and practice: learning these prefixes and suffixes allows scribes to quickly understand new terms, for example, combining hypo, below normal, and glycemia, blood sugar, logically leads to hypoglycemia, meaning low blood sugar levels. Specialty specific phrases. Each medical specialty has terms and phrases essential for describing symptoms, conditions, diagnostics, and treatments unique to that field. Below are examples from key specialties. Cardiology, heart specialty. Myocardial infarction, MI for short, meaning heart attack, caused by reduced blood flow to heart muscles. Example: in practice, patient presented with chest pain and was diagnosed with myocardial infarction. Arrhythmia, meaning irregular heartbeat. Example: monitoring for arrhythmia was conducted during the cardiac stress test. Neurology, cerebrovascular accident, CVA, meaning stroke caused by disrupted blood flow to the brain. Example: in practice, the patient exhibited left-sided weakness indicative of CVA. Epilepsy, meaning a disorder characterized by recurrent seizures. Example: EEGs were performed to confirm the diagnosis of epilepsy. Oncology, metastasis, meaning spread of cancer from a primary site to other parts of the body. Example: in practice, metastasis was detected in the liver during follow-up imaging. Carcinoma, meaning cancerous tumor. Example: biopsy confirmed squamous cell carcinoma. Gastroenterology, the GIT, gastrointestinal tract specialty. Gastroesophageal reflux disease, GERD, meaning chronic acid reflux causing irritation of the esophagus. Example: in practice, the patient has GERD managed with the proton pump inhibitors. Colonoscopy, meaning visual examination of the colon using a scope. Example: a routine colonoscopy was recommended due to the patient's age and family history of colorectal cancer. Techniques for mastering medical terminology. Flashcards. Flashcards are a simple yet effective tool for memorization. Example: create flashcards with cardio, heart, on one side, and examples like cardiovascular, cardiology on the other. Word association, associating unfamiliar terms with easily recognizable concepts. Age learning, for example, link neuro with nerves to recall terms like neurology or neuropathy. Practice and repetition and exposure through repetition reinforces understanding. Example: when documenting, break down new terms and recite their meanings. Practical tip: medical scribes can use patient cases to build their vocabulary as regular use, and cross-referencing medical dictionaries or electronic resources further solidify knowledge. Challenges in learning medical terminology. Complexity. Many terms are derived from Latin or Greek, which can be daunting for new learners. Solution: focus on learning root words as they provide the core meaning. Volume. The sheer number of terms makes learning overwhelming. Solution: prioritize frequently used terms relevant to the scribe's clinical setting. Real-world example: a medical scribe working in a cardiology practice should focus on terms like ischemia, reduced blood flow, angina, chest pain, and hyperlipidemia, high cholesterol. Examples of clinical practice application: precision documentation. Accurate terminology ensures clinicians can, or providers, can interpret patient records effectively. Example writing: patient presents with tachycardia, clarifies the symptoms nature rather than a vague as in fast heartbeat. Patient communication, simplifying complex terms when explaining conditions, builds trust and understanding. Example, telling a patient you have high blood pressure instead of you have hypertension ensures comprehension. Summary tables for consolidation. Here table of on basic structure of medical terms, component, and description for each. Table on common medical prefixes and suffixes, type, example, meaning. Table on specialty specific phrases, specialty phrase, meaning. Table on techniques for mastering medical terminology, technique description for each technique. Summary tables. Here we have table on basic structure of medical terms, table on common medical prefixes and suffixes, table on specialty specific phrases, table on techniques for mastering medical terminology, table on challenges in learning medical terminology. And then after that, we will be revising what we have covered via this lecture through some MCQs or multiple choice questions. Question 1. What does the root word cardi refer to in medical terminology? Lungs, A. B. Stomach. C. Heart. D. Brain. C. Heart, as the root word cardi, C-A-R-D-I, pertains to the heart as in cardiology, study of the heart. Question, which prefix is used to indicate something is below normal? Is it A. Hyper, which is high, B. Hypo, which is below normal, C. Teki, fast or slow, D. Brady. It is B. Hypo, as hypo means below normal, as in hypoglycemia, low blood sugar, or hypotension, low blood pressure. Question 3, what does the suffix algia mean? We remember algia means pain, neuralgia, nerve pain, example. A. Disease, B. Pain, C. Surgical removal, or D. Visual examination, as in B. Pain. Algia indicates pain, as in neuralgia, nerve pain. Question 4. Which specialty would focus on the condition cerebrovascular accident, CVA, which is the brain, disruption of the blood flow in the brain, in this case, neurology, the nerve specialty. A. Neurology, B. Cardiology, heart, C. Oncology, tumors, or D. Gastroenterology, GIT, or gastrointestinal tract diseases. And the answer is A. Neurology, as CVA, commonly known as a stroke, is a condition related to the brain and is studied under neurology. Question 5. Which technique is helpful in learning and remembering medical terminology? A. Ignoring Latin or Greek roots, B. Writing terms once, C. Using flashcards to memorize terms, or D. Avoiding repetition to prevent confusion. Answer is C. Flashcards, as flashcards are an effective tool for memorizing and mastering medical terminology. And here we come to the end of this lecture. Thank you very much and goodbye.